God himself is beautiful and loves beauty. So it's in French here. My question is that what do you expect when you meet someone? What first five things would they notice? Can you answer that? Maybe a cup of coffee if you, yeah. But there have been studies and they said 47% of people said smile. So it's basically smile, and I mean, because our specialty is concerned with the smile. So we'll talk everything good about the smile, you see. And when you think of smile, the first thing being in France that comes to your mind is Mona Lisa, the great painting by Leonardo da Vinci. And you see, it completely depicts aesthetics, which is the science of beauty in nature and arts. And ladies and gentlemen, this is from the dentist's aspect, dentist's point of view, having teeth there. And this is IMCAS Mona Lisa, you see, with a pouch smile, the modern Mona Lisa. So the goal is to restore your smile in the most holistic way, ladies and gentlemen, because you see, when you recreate that smile, that can really boost up the greatest level of confidence, building a complete harmony and balance in your smile and face. Thus, it gives a great boost to your self-esteem and confidence. And our specialty, implantology, that really plays the greatest possible role to enhance the tooth. You see here the lost architecture, and we replace them with the implants, followed by the teeth here. So, what do you think? Why is it important to replace missing teeth? I would not give a formal answer that builds up your personality or gives you greatest aesthetics, but to talk simple, because life is too short. And you should smile whenever you get a chance and whenever you have teeth. You see here the picture of Julia Roberts without teeth and with teeth. So smile, smile, smile. Because there are so many bad consequences of tooth loss. You see, you have facial harmony when you have good teeth, a bone, but as soon as you lose teeth, there is a 40 to 60% of bone loss in the first year after the tooth loss. And that tooth loss continues until you end up with all the bone and left with the basal bone only here. And I would like to show you this sequence of tooth loss through a video clip. You see, you have teeth there and everything is balanced. But when the teeth are gone, there is a disuse atrophy of the bone, and the bone starts resorbing. And that is depicted in the facial, in the countenance, and then you end up with wrinkles. You have devastating aesthetic results, you see on the right. You decrease your vertical dimensions, and your lines are deepened, resulting in thinning of the lips, developing into a bad class 3 relationship. So we don't want this happen. That's why we have aesthetic dentistry, which can, you see, just in 6 months' time, you can bring it from here to there. And mind you, it's not a temporary treatment. We are putting, as we have this conference, you know, fillers and this. This is that we have rejuvenated, reconstructed the bone, and it will stay there as long as it's in function. So, ladies and gentlemen, these procedures, they truly enhances your face to bring your smile and visage into a complete harmonious balance. So, what do you think? What are the different options? Everybody knows these are the traditional ways, dentures and bridges or implants. But I'll show you a clip which depicts if you replace with dentures or traditional ways, what happens. Now, this is a wedding going on, and the holy water is presented to the bride. But look, what happened? She lost her tooth, and there, the teeth were dropped in the glass of wine, in the glass of holy water. So, because of this, I think you would not like to have those dentures, and the solution is in implant dentistry, which truly overcomes all these disadvantages and gives you a real boost of life, a boom of life. Ladies and gentlemen, here we are, you see, without teeth and with teeth. This is the greatest advancement in present day dentistry, that you reconstruct the hard and soft tissues and bring that lost aesthetics and function. And the ideal restoration should depict, as you see the fairy images here, and similarly, this tooth should be replaced exactly in this similar manner, same aesthetics and function. The patient presented with an accident an hour, say 11 o'clock in the morning, and we did some of these manipulation procedures, and by 12 she was having this tooth there. But you see, this journey has changed in past 15 years or so. Today's era is the architectural era of implantology, ladies and gentlemen, that we do not accept the compromises, because now lack of bone is not an issue. We have the potential of restoration because we believe that whatever has been granted to us by God is reverend. And our goal in reconstructive surgery is directed to restore that lost form and function. I'm talking of hard and soft tissue reconstruction. And we understand that when the tooth is gone, the bone is gone from the facial and vertical and from the sinus enlargement. Now, ladies and gentlemen, in a relentless pursuance of perfection for long-term stability of tissues, we have found a definitive solution, and we call this concept bone renaissance. Bone renaissance. As the name says, and I would like you to please concentrate on the picture here, that this is a unique philosophy encompassing on sequential and codified, if you see the face, reversal of the bone back to its original 3D engineered divine osseo-architecture. Ladies and gentlemen, this is bone renaissance. And after seeing this picture, everybody would like to have his or her lost smile back. And here we do. With the help of bone renaissance, ladies and gentlemen, this is the area showing loss of teeth, and we manage to recreate that stable bone back to its original, you see here, 3D engineered divine location, dimensions, and quality, ladies and gentlemen, to bring back that lost smile. Now, these are the components of bone renaissance, and I'll just discuss them, that when we replace the teeth, there should be a natural harmony in all these segments of the jaws, and that when you have horizontal deficiency, they can best be covered by expanding the bone, by manipulating the bone through flapless surgery, because we do not reflect flap. We believe that periosteum supplies the greatest blood supply to the bone, 90%, and 70% of the periosteum is through the periosteum. So as long as it is there, the periosteum is there, the bone, especially the maxillary and the mandibular bone, they remain completely plastic. You can expand the bone. And we also do flapless in order to minimize the vascular insults to the bone, so it has the potential of regrowth. And so the Renaissance technology is 5 in modulus operandi, a method, a surgical technique, a traumatic, where we employ both motor-driven and surgical-driven expanders, together with the incorporation of the stem cells and modern growth factors. Here you see, We use tissue engineering in that, and we employ them along with our expansion techniques in order to regain that lost smile. You see here, this is a ridge which has gone down up to 1 millimeter, and you must learn that through bone renaissance, we can split the bone, expand the bone, and bring back, with the incorporation of these advanced instruments, the same bone back to that natural contour. You see here the hole, which was less than a millimeter and has been expanded in order to house a 5 millimeter broad implant to be utilized there for best possible aesthetics. Ladies and gentlemen, this is the same day there, and you recreate that same original 3D divine smile. You see, this is bone renaissance, resurrection of lost contours from top left back to that youthful smile. 70 years, and that is 17 years, ladies and gentlemen. Now, when you have vertical deficiencies, we take care of them through vascularized segmental osteotomies here. We bring, you see here, you have a big defect, vertical defect. So we split the bone, bring the natural bone down, and sandwich some irradiated bone block graft there, here, in between. And from here to here, you see, it took a couple of hours. Then we placed the implant, and X-ray showing restoration, and back to 3D original divine osteoarchitecture. And when you have deficiency in the posterior area, we do sinus graft those areas. We put some bone augmentation there, followed by placement of implants. You see, a 1 millimeter bone was grafted there, space was grafted with a 20 millimeter bone, and back to that original 3D divine osteoarchitecture. We do take care of soft tissues in order to give them the best possible aesthetics, shape, that lost contour, and enhance the deficient tissues. And also, smile makeovers is an important component. Look at that smile here. And with a gentle manipulation, in less than an hour, you come back to that smile, ladies and gentlemen. Another one here. And this is a permanent solution, not a 6-month or a 1-year solution, ladies and gentlemen. And showing you the final case. This is a traumatic case. You have such a big defect, patient would hate to smile. So we went and did a tunnel grafting, reflected the flap here. You see the defect, and placed a block graft, screwed it in, did some tissue management, suturing, and there you see, from here to here, the same 3D osteoarchitecture, ladies and gentlemen. This is bone renaissance. And today, I would like to give you a message that you just learn to give a smile. Maybe if it's a stranger, maybe that could be the only sunshine she or he has seen that day. And with that, I say thank you very much, ladies and gentlemen. Merci beaucoup. Thank you and goodbye.